Dr. Sreejith, ഒന്ന് അൺമ്യൂട്ട് ചെയ്തിട്ട് മറ്റേ വീഡിയോ കൂടി ഒന്ന് സ്റ്റാർട്ട് ചെയ്യാവോ? വോയിസും ഓഡിയോ ക്ലിയർ അല്ലേ എന്ന് അറിയാൻ വേണ്ടിയിട്ടാണ്. ഒന്ന് സംസാരിച്ചു നോക്കോ?
ക്ലിയർ ആണോ?
ക്ലിയർ ആണ്. യെസ്, ഓക്കെ. അപ്പൊ ആൾക്കാർ കയറിക്കൊണ്ടിരിക്കേണ്ടത് നമുക്ക് ഒരു മൂന്ന് രണ്ടുപേരൊക്കെ വെയിറ്റ് ചെയ്യാം. ഒരു കയറിക്കോട്ടെ.
ആയിക്കോട്ടെ,
ശരി, ഞാൻ അവിടെ ഉണ്ട് കേട്ടാ. നമസ്കാരം സർ. സാറിന് സ്റ്റാർട്ട് ചെയ്യാറാകുമ്പോൾ സ്റ്റാർട്ട് ചെയ്യാം കേട്ടോ.
ഗുഡ് ഈവനിങ് ഡോക്ടർ ശ്രീജിത്ത്.
ഗുഡ് ഈവനിങ് സർ.
4 മണിയാ പറഞ്ഞിരിക്കണം. ഒരു 4:02, 4:03 തുടങ്ങാം.
ആയിക്കോട്ടെ.
എല്ലാവരും ആവട്ടെ. ഗുഡ് ഈവനിങ് ഡോക്ടർ സ്മിത.
Good evening, doctor.
Hello, doctor. Good evening.
Good evening.
Carabinian. തുടങ്ങാൻ ഡോക്ടറെ. ഹലോ.
തുടങ്ങാം.
ഞാൻ ഇൻട്രൊഡ്യൂസ് ചെയ്യാം. Good evening doctors. As you all are aware about AVS Kottakkal, and we have been conducting continuous medical education section for Ayurvedic doctors. Today we have the topic on lung disorders and their Ayurvedic prescription. We have Dr. Sreejith, Deputy Physician, Ayurveda Kottakkal, and he is the today's speaker. And we have a resource person, Dr. Smitha K, Deputy Chief Physician, Ayurveda Kottakkal. I request the speaker, Dr. Sreejith, Deputy Physician, Ayurveda Kottakkal, to present the section on lung disorders and their Ayurvedic perspective. Dr. Sreejith, you may present your session.
So, good evening, doctor. Thank you for giving me an opportunity for presenting this section. On behalf, I am very thankful to Ayurveda also for giving me that opportunity to present this section. Today my topic presentation is lung disorders and Ayurvedic approach. Before coming to the lung disorders, first we should explain about respiratory system. What do you mean by, or what we mean by system? It's a biological system consisting of specific organs and structures used for the process of respiration. And what is the goal of breathing? The goal of breathing is to deliver oxygen to the body. Coming to respiratory diseases, may be due to 4 reasons. It may be due to infections. It may be obstructive.
Excuse me, doctor. ഡോക്ടറുടെ സ്ലൈഡ് ഡോക്ടർ നീക്കണില്ലല്ലോ അല്ലേ? മുന്നോട്ട് പോണില്ല.
ഞാൻ നീക്കുന്നുണ്ടായിരുന്നു.
ആണോ? ഇവിടെ പക്ഷെ മുന്നോട്ട് പോണില്ല ഡോക്ടറെ.
ഇപ്പൊ ചേഞ്ച് ആവുണ്ടോ?
ഇല്ല, ലങ് ഡിസോർഡർ അവിടെ തന്നെ നിൽക്കുക.
അതെയോ? ഒരു മിനിറ്റ്.
ഓ,
ചേഞ്ച് ആവുന്നുണ്ടോ?
അപ്പൊ ചേഞ്ച് ആവുന്നുണ്ട്. യെസ്. ചേഞ്ച്
ആവുന്നുണ്ടല്ലോ അല്ലേ?
ഡോക്ടറെ.
Okay. Coming to respiratory diseases, it's of 4 types. We can say generally it's of 4 types due to infections such as pneumonia. It may be due to obstructive disorders, airflow into lungs, and such as asthma, bronchitis, and emphysema. Third one is restrictive disorders, are conditions that limit normal expansion of the of the lungs, such as pneumothorax, stasis, respiratory distress syndrome, and cystic fibrosis. Like diseases will be there in that respiratory type. And other one are cancers, or maybe due to the other diseases due to the inhalation of the chemical substances or inhalation of other type of pollutants, etc. That will result in altering the pulmonary function. General symptoms we can see in respiratory pathology is hypoxia, hypoxemia, hypercapnia, hypocapnia, tachypnea, cyanosis, and hemoptysis. Coming to another classification.
Doctor, unmute you. എല്ലാവരും mute ചെയ്തിരുന്നു. ആ background noise പോകാൻ വേണ്ടിയിട്ട്.
Ready alle?
Continue.
Okay. Coming to respiratory, coming to the another criteria respiratory disorders, we can three types: upper respiratory tract infections, lower respiratory tract infections, and both may be coming in a patient. Both coming. First, upper respiratory tract infections can then later shift to lower respiratory tract infections. Commonly, organs capable for infecting respiratory structures include bacteria, virus, and fungi.
Doctor, head സംസാരിക്കണേ.
അതെ, ഹെഡ്ഫോൺ വെച്ചാണ്.
എനിക്ക് തോന്നുന്നു എന്തോ ഒരു ഹെഡ്ഫോൺസ് ഊരി സംസാരിച്ച് നോക്കാൻ പറ്റുമോ?
ഓക്കെ നോക്കാം, ട്രൈ.
ശബ്ദം അങ്ങനെ വരുന്നുണ്ടേ.
ഓക്കെ
അതൊന്ന് ഊരി സംസാരിച്ച് നോക്കൂ. കേൾക്കണില്ലെങ്കിൽ നമുക്ക് എന്ത് ചെയ്യാം, ഹെഡ്ഫോൺസ് വീണ്ടും വെക്കാം.
ഓക്കെ
ഒന്ന് സംസാരിച്ച് നോക്കൂ ഡോക്ടർ. ഒന്ന് സംസാരിച്ച് നോക്കൂ.
ഇപ്പൊ ക്ലിയർ ആണോ?
ക്ലിയർ ആണ്. ഇത് മതി, ഇത് വേണമെന്നില്ല, ഇത് മതി.
Okay, coming to the respiratory tract infections, upper respiratory, especially, two diseases will be coming. That is common cold and influenza. The most common viral pathogens resulting in common cold are rhinovirus, parainfluenza, adenovirus, coronavirus, etc. Actually, if we didn't treat the upper respiratory tract infections properly at the time, it may result into lower respiratory tract infections. Second one is influenza. As you know, there are three distinct forms of influenza virus has been identified. They are A, B, and C. Three types are there. The common symptoms here I have mentioned is headache, fever, chills, muscle aches, nasal discharge, unproductive cough, sore throat, etc. And its incubation period will be 1 to 4 days. These are the general symptoms I have given in a slide. Coming to the Ayurvedic concept, it can be correlated with the Pradishaya. Its lakshanas mentioned in Ayurvedic textbooks are Tasirubam, Shirashulam, Gauravam, Grana, Viplavam, Jura, Kasa, Kafot Kledam, Ekshma, like that. Coming to the Samprapti, due to the various etiological factors, doshas are getting vitiated and situated inside the Nasikendriya, which in turn led to various symptoms like Shirashula, Jwara, Suraveda, etc. It's a treatment mentioned in the classics is, the first line of treatment mentioned is Nidana Parivarjana. Second step is Samprapti Vidadana. And third one is Patyapalana, and obviously the fourth one is the prevention of the remission of the diseases. I will come later to this slide. Coming to the lower respiratory tract infections. The respiratory tract is usually protected by a number of very effective defensive mechanisms designed to keep the infectious organism and keep infectious organism and particulates from reaching the lungs. For an organism to reach the lower respiratory tract, organism must be particularly virulent and present in very large numbers, or the host defenses barriers must have been weakened. These are the defenses of the respiratory system. There are mainly five are there. First one is a mucus covered surfaces, which traps the particles and organisms. Second, there is cell surface, IgA and lysosomes. Third one is ciliated epithelium, which clears the trapped particles and organisms from airway passages. Fourth one is cuff reflex and epiglottis, prevents aspiration of particles and returns into the lower airways. The fifth one is pulmonary macrophages, which phagocytes the foreign particles and organism in the alveolar spaces. Coming to the respiratory infections, we will discuss is pneumonia. Pneumonia mainly it's affect the small air sacs, which is called as alveoli in the lungs. Pneumonia is due to the infections caused by primarily by bacteria or viruses. It may be causing. Very less commonly by fungi also it may happen. Coming to the symptoms, maybe productive or dry cough will be there. Chest pain, fever, difficulty in breathing, all the symptoms will be accompanying when the upper respiratory tract infections which shift into pneumonia. Potential pathogens we can discuss here is Streptococcus pneumonia, the Haemophilus influenzae, Mycobacterium catarrhalis, Klebsiella pneumoniae, Legionella pneumophila, Mycoplasma pneumon, etc. In that, the characteristic features are there. First, I will mention Streptococcus pneumonia. In that, particularly the rusty colored sputum will be there. In Klebsiella pneumoniae, bloody sputum can be seen. In next one, in Legionella pneumophila, abdominal pain, diarrhea, confusion, all the symptoms will be in Mycoplasma pneumon, neck like symptoms will be happening. These are the general symptom wise it is mentioned, and systemic high fever chills will be there. In central, headaches, loss of appetite, mood swings, all the symptoms will be there. Coming to the vascular, low blood pressure. Coming to the heart, high heart rate will be there. Maybe coming to the gastric symptoms, nausea, vomiting, all the things will be there. Joint pain, muscular fatigue, aces. And coming to the lungs, cough with sputum or shortness of the breath, pleuritic chest pain, hemoptysis will be all the symptoms will be there accompanying pneumonia. Coming to the next, I'm coming to the restrictive type of pulmonary disorders. In this, we can include pneumothorax. A collapsed lung occurs when air escapes from the lung. Then the air then fills the space outside the lung between the lungs and the chest wall. This will build up. This buildup of air puts pressure on the lung, so it cannot expand as much as it normally does when you take a breath. Collapsed lung can be caused by an injury to the lung, gunshot, whether it may be a gunshot, whether it may be knife wound to the chest or fracture, etc. The air pressure changes, such as when scuba diving or traveling to a high altitude, may also affect. Mainly manifestation in this pneumothorax will be tachypnea, dyspnea, chest pain. All these symptoms will be there. Coming to the second type, atelectasis will be there. Is caused by the blockage of air passages, whether it is bronchus or bronchioles, or by the pressure on the outside of the lung. Due to that, this type of disorder will occur. It is a condition in which there is incomplete expansion of the lung tissues due to the blockage of the airways, or maybe due to the compression of the alveolar sacs. Two types are there. absorption and compression. Two varieties, two types of atelectasis is there. That is absorption and compression. In absorption, blockage of the bronchiole will happen. Due to that, the reduced gas exchange will be there. So that due to the lack of oxygen and all, collapse of the alveoli will may occur with conditions such as chronic bronchitis or cystic fibrosis, etc. In this type of condition, the absorption type of disease will be occurring. Coming to compression, as the name suggests, because when the lung tissue is compressed externally by air, blood, fluids, or tumor. In these cases, the compression type of disorder will be occurring. The main symptoms will be dyspnea, cough, cyanosis, chest pain. Due to the reduced gas exchange will be happening. In coming to the, as our topic is lung disorders and Ayurvedic approach, this type of diseases, the first we have to go for the emergency management, as this may become very life-threatening condition. As the pathology is the inability of the lungs to do a proper function, we can consider them as Shadaja, whether Shadajakasa or Shayajakasa. Particularly, we can take as Shayajakasa. As a pathology is the inability of the lungs to do the proper function. In later on, after the emergency management, we can shift to our treatment in order to strengthen the lungs as well as to the reoccurrence of the disease. That mainly Brahmana line of treatment can be given. First, initially, Acne type of treatment we can give. Both Jadracne and Adwacne should be increased by giving Ingvajadi or Ingvashta Churna, like that of line of treatment we should give initially. Second, Snehana with Brahmana Gradas like Induganda and Shatpala Grada can be used. Snehana with Brahmana Gradas like Induganda or Shatpala Grada can be used. Before that, we should go for Sroto Shodanam. For that, Dashamula Ardeki Lehem, like that medicines we can have a try. Then Mrudu Virajana treatment can be using the Avivati Churna. We can try in this type of condition. Later we can come to the Rasayana Praga to prevent the reoccurrence of the disease. For that, Vasishta Rasayanam, Kushmanda Rasayanam, Chavana Prasham, Agastya Rasayanam, Haridaki Rasayanam, like medicines we can have. Right. Coming to the second obstructive type, bronchitis, we can, two types are there, especially acute bronchitis is there and chronic bronchitis is there. Acute may be causing due to virus or bacteria. Chronic may be causing due to airborne pollutants. Coming to acute is a swelling and the inflamed tissue in the main passages that carry air to the lungs. This swelling narrows the airways, which makes it harder to breathe. Mainly the symptoms will be occurring in this will be, as you know, cough and cough. Acute bronchitis is generally a self-limiting condition. Healthy individuals can get rid from it very faster. In immunocompromised patients, it will be very difficult to manage. Coming to acute bronchitis, inflammation of the bronchial passages most commonly caused by the infection of the bacteria or virus. As I told earlier, the symptoms will be acute bronchitis. Symptoms of acute bronchitis will be initial of dyspnea. Coming to the manifestation of the chronic bronchitis, maybe productive or productive cough, production of the purulent sputum, frequent acute respiratory tract infection, dyspnea, hypoxia, cyanosis, etc. Fluid accumulation in edema in later stages will be happening in chronic bronchitis. It's a picture of the normal bronchi and the person who bronchi of the person who is having the bronchitis. you can see the difference. Ayurvedically, as we are talking about the lung, Ayurvedic view in lung disorders or lung diseases, we can, by noticing the symptoms, we can correlate it with the Kaphaja Kasa. In Kaphaja Kasa, usually Jara will be there, reduced acne will be there, along with the symptoms as same as that of bronchitis can be seen. Coming to the management or treatment line, as a treatment line in Kaphaja Kasa, coming to the classics, Snehana, Swedana, Snehana, Vamana, Videjana, and Tikshno Shiro Videjana. Tikshno Shiro Videjana. This type of treatment line is mentioned by our Acharyas. And the medicines which are mentioned in the classically, they have mentioned Kandagari Grada, Yakriyadi Lehya, and especially Shamana Duva, which this also we can do practically in our clinical practices. Shamana Duva, basically of Kasakna Dravyas we can use, using the Kasakna Dravya Shamana Duva. Coming to the next type, obstructive type, that is bronchial asthma. Asthma is a condition characterized by the reversible bronchospasm and chronic inflammation of the airway passages. Nowadays, the cases of the asthma has been very steadily increasing also. Maybe genetic predisposition factor will be maybe the cause for one reason, maybe not maybe the cause, one reason for increasing cases will be genetic predisposition, and also a key component of the asthma appears to be airway hyperreactivity will be there in affected individuals. Exposure to the certain triggers that can induce marked bronchospasm and airway inflammation in some patients. Some of the potential triggers will be allergen, cold air, pollutants, cigarette smoke, strong emotion, exercise, respiratory tract infection, etc. You can see the differences in the inflamed bronchial tube of an asthmatic, and in the right side you can see the normal bronchial tube. In non-asthmatic patient, the muscles around the bronchial tubes are relaxed and tissue is thin, allowing for the easily airflow. In the left side, you can see that it's all thickened and all muscles and the bronchial tubes are tightened and thickened. Clinical classification: mild intermittent, mild persistent, mild moderate persistent, severe persistence, according to the severity of the attacks. It is classified. Common manifestations of asthma are coughing, wheezing, difficulty in breathing, rapid shallow breathing, increased respiratory rate, excess mucus production, significant anxiety will be there associated in the patients. Significant anxiety also will be there. That will trigger the asthma attacks also. Staging on the basis of severity, there will be stage 1, mild, stage 2, moderate is there, stage 3, severe, stage 4, which will be resulting in the respiratory failure at the last stage. 4 types of stages are mentioned: mild, moderate, severe, and the last stage, especially coming to the respiratory failure. And severe acute asthma, that is status asthmatics, which is life-threatening condition of prolonged bronchospasm. It may be not responding to for drug therapy also, and probably pneumothorax will be as a complication of asthma. Coming to the Ayurvedic part, as Shwasa arises by the increase of the cough, Nidanas are mentioned in Nidanas. Coming to the Nidanas, Shwasa arises by the increase of the cough. Doshagopa will be there. Amadisara, Vamadu, Visha, Pandu, Jwara, Dhumanila, and excessive wind and cold, exposing to excessive wind and cold. Marmagada, it's a reason for asthma as mentioned by our class 6. and adihimambupana, over drinking of cold water, like that, Nidanas, our Acharyas have mentioned. Coming to the Samprapti, Vada obstructed by Kapha, that will result in the vitiation of Prana Udaga, Anna Srotas, which is located in the urus, and produce Shasa arising from the Amasha. It's a Samprapti mentioned by our Acharyas. Urastha Gurude Shwasam Amashe Samutpavam is mentioned by our Acharya. Coming to the Purva Rupa, Hritparsha Shulam, Prana Vilomada, Anaha, and Shanga Veda is mentioned. Bronchial asthma can be compared with Tamaga Shwasa. So, in that, Vada vitiates, which moves in upward direction, Shiras, and aggravates the Kapha and produces Shwasa. And the common symptoms mentioned in Tamaga Shwasa, that is, we can compare with bronchial asthma, pain in Shiras, Griva and Parsha, Kasam Gurguragam, that is the cracking sound hearing, Moham Aruji Pinasam Trishna, and breathing comfort on sitting. As it is explained by our Acharyas in our classics. And also it is mentioned by our Acharya that the asthma will be increasing. The symptoms will be increasing by cloud, cold wind, cold water, etc. The same thing which we can, when we come to the practice, the same experience from the patient we can hear. Coming to the treatment protocol regarding the lung diseases, especially bronchial asthma, in that classically we can give Sneha Svedana by using the oil mixed with the salt and all salt. What is the reason for that is it will after the Svedana it will liquefy the kapha, and after that mild vamana can be given using Bipali, Saindava and honey, especially which is not opposite to the Vada. Coming after that Virechana. For Tapashwasa, Virechana is an important treatment which is mentioned by our Acharyas. And Lomana using purgative drug mixed with Saindava or Saindava and superfood can be given. And next one is Dhumapana. Dhumapana, certain medicines are mentioned by our Acharyas. This also we can practice in our daily life. In our presence, especially Divana Pajana, drugs should be given. Aushadhala, it's mentioned in Sutrasana that for Visha Chardi Hidma, the person should be given. Coming to the bronchial asthma, the main line of treatment we should, personally, my opinion is Samshamana type of treatment is more wide and practical. The reason for that is it is applicable in all cases and all stages. The Shamana therapy in this case includes the Deepana Pachana, Vada, Kapha Vada Shamaka drugs along with the drugs that purify Pranava Srotas. Children and old subjects are also managed. They can be easily managed with the Shamana therapy. Treatment according to various stages of disease, Vegavastha and Avegavastha. Coming to Vegavastha, Divana Pachana, Vada Kafara, Sroto Shodhana, and Shodhana therapies can be given. Dhumapana, Nasya, etc. can be practiced. And mild Svedana of the chest region by a hot bag or various type of potalis can be tried in Vegavastha. In coming to Avegavastha, Vada Kafara treatment, Valavardhana, Ushnaguna, mainly Shamana Ushadis. In Avega Avastha, mainly Shamana Ushadis can be given. Pradimarsha, especially Pradimarsha Nasya can be given. Abhenga with oil and Saindava can be given in Avega. And mentioned earlier, Rasana type of treatment. The drugs given should increase the Vyadhi Shamata of the patient. This type of treatment line is better in Avegavastha. Coming to some of the drugs which is generally used in this type of lung disorders or respiratory disorders are Vasa, Brahmi, Pippali, Haritara, Kandagari, Tulasi. Coming to the Dosharata, most of them are Kaphavadhara, that is Vasa, that is Kaphavadhara, and also it is a bronchodilatory drug. Brahmi, it is Kaphavadhara, it is a bronchodilatory activity. Pippali, it is antihistaminic activity. Haritra, anti-allergic activity is there. Kandagari, Vada Kafara, and some research done. It is shown that in pulmonary function test there is marked improvement. Kandagari. Then the next one is Tulasi. It is also Vada Kafara. It is also expectorant and antihistaminic activity. It is very helpful in asthma also. So the combination of this drug or as a single drug, we can widely use these medicines in our daily practice. Coming to the another type of obstructive respiratory, another type, that is emphysema. Emphysema is a respiratory disease that is characterized by the destruction and permanent enlargement of terminal bronchioles and alveolar air sacs. As a result, it reduces the total alveolar surface available for gas exchange, leading to the reduction in oxygen supply for the blood. Some of the risk factor is middle-aged and older population are more prone for getting this disease, and tobacco smoking can aggravate this disease, and also the antitrypsin deficiency is a genetic risk factor. Actually, excess release of protease enzymes such as trypsin from lung tissues and leukocytes can digest and destroy the elastic walls of the alveoli. So, the levels of a protective enzyme, that is antitrypsin, alpha-1 antitrypsin, have been shown to be lacking in certain individuals who are chain cigarette smokers. So, the lack of that antitrypsin may be a causative factor for getting emphysema. In fact, a rare form of emphysema occurs in individuals who are not cigarette smokers, but who have genetic lack of alpha-1 antitrypsin. Manifestation tachypnea, especially the barrel chest due to the prolonged expiration and lack of purulence, pudum, and possible long-term consequences maybe core pulmonale will be happening, which that will lead to due to respiratory fail. And coming to the Ayurvedic concept, in emphysema we can see both the lakshanas of Shwasa and Kasa. Symptoms of Vadaja Kasa, mainly we can say that symptoms will be there of Vadaja Kasa and Tamaga Shwasa. But all the lakshanas can be seen. It's a mixed condition. Predominance of Vada over Kapha can be seen in some conditions. In some patients also we can see by looking to the symptoms. Generally the lakshanas like wheezing, a lot of mucus, all the things will be seen. Coming to a comparison, there are emphysema is divided into 4 stages. First stage is mild. Second stage is moderate. Third one, severe symptoms will be there. Stage 4, very severe symptoms will be there. So coming to the mild, it increases with exertion. As it is said by our acharyas in Shudra Shwasa Lakshanas. Stage 2, moderate, mainly Vadaja and Kaphaja. Vadaja, dry cough will be there. Kaphaja, mucus, a lot of mucus will be there. And also Pittaja lakshanas can be seen in stage 2, that is inflammation around the air spaces. Coming to stage 3, the symptoms we can see like Tamaga Shwasa, which is very difficult to cure also. Coming to stage 4, lakshanas we can see we can compare with Urdu Shwasa. In Urdu Shwasa, heavy breathing will be there. Or next is Mahashwasa. We can compare, almost we can compare. Like Mahashwasa, prolonged expiration, we can see. Like along with that rolling eyeballs and the terrified look the patient will be having. Coming to the Ayurvedic treatment, as we mentioned, the Shasa can be, Shasa treatment can be taken. In the stage and the symptoms, Vadaja Gasa Chilsa, Kafaja Gasa Chilsa, and Shudra Shasa Chilsa, Tama Shasa Chilsa, even Rajeshma Chilsa can be incorporated in this type of disease. Coming to the next one, it is bronchiectasis. It's a disease in which there is a permanent enlargement of parts of the airways of the lung. General symptoms will be chronic cough along with the shortness of the breath, productive cough. One of the main symptoms is a whistling sound where you breathe. Crackles, rhonchi, wheezing, and mild inspiratory cues can be seen in this type of bronchiectasis condition. Coming to the pathophysiology of the bronchiectasis, initial injury to the lung will be there, such as from the infection, autoimmune destruction of the lung tissue or other destruction of the lung tissue will be occurring. Then immune response from the neutrophils, elastases, reactive oxygen species, and inflammatory cytokines that result in progressive destruction of the normal lung architecture. It will all of these causes will cause the destruction of the normal lung architecture in bronchiectasis. Coming to the Ayurvedic concept, bronchiectasis, which can compare with Shadaja Kasa. In Shadaja Kasa, our Acharyas has said that the cooing sound like that of the pigeon from the throat. Paravadeva Kujanam, like that, he has clearly mentioned as the same type of symptoms we can get in bronchiectasis also. In that injury due to the injury to the lungs will be there. So especially Vada Prakopa along with the Pitta causes cough. In that sputum mixed with blood, even dry cough with blood is also seen in this type of condition. And obviously dyspnea will be there, thirst will be there, emaciation will be there. So we can have this condition we can compare with Shadaja Kasa. Coming to the Ayurvedic line of treatment for bronchiectasis is Jivaniya Gana, that is Shadaja Kasa Chilsa. We can incorporate into this type of disease. Jivaniya Gana drugs using, we can make ghee and give. Laksha with honey and milk can be given. Ghee processed with Madura drugs. Rasayana drugs preparation can be given. In bleeding, we know that Raktapitta, obviously Raktapitta Chilsa should be incorporated in this type of in this condition. Drushakada can be given, and as a Rasayana drug for emaciation and all Amrita Prashagrada, Madhugadigrada, Tatriyadigrada, Ushmanta Rasayanam, Agastya Rasayanam, Vashishta Rasayanam. According to the yukti of the consultant physician, all this type of treatment can be incorporated in this condition. And coming to the cough as so in Ayurveda, it is Kasa is mentioned as a separate section. Mainly, coming to the modern cough, they have mentioned it as a disease, but it may be a result of some of other pathologies in the body. Cough will be occurring in a patient. Cough is a sudden and often repeatedly occurring reflux which help to clear the large breathing passages from secretions, irritants, foreign bodies, and microbes. But on the other side, it can be manifested as a mirror of very complex internal pathologies also. While treating a patient with coming with cough, we should first ask how long the cough is there. Is it sudden How many days of infection we should check for infection. If it is it has happened by weeks or long term, he is having the cough, it may be a sign of bronchitis, pneumonia, TB, some sort of cancer, etc. can be happening. It is 3 types of cough will be there. Acute, less than 3 weeks. Subacute, 3 to 8 weeks. Chronic, more than 3 weeks. Just have a look. Most cough acute for the most common causes for the acute cough will be common cold, acute bacterial sinusitis, pertussis, exacerbation of the COPD. Allergic rhinitis may be a cause. Coming to evaluation of the chronic cough, heartburn and regurgitation suggest may be a cause for the cough, repeated cough. So we should treat for that gastroesophageal reflux disease in some conditions. In cough associated with wheezing, which can suggest asthma also. Coming to the Kasa, Ayurvedic type, there are 5 types of Kasa mentioned in our classic, that is Vada, Pitta, Kapha, Shadaja, and Shayaja. Purvarupa mentioned are Kande, Kandorochaga, Sugapurna, Kandatto. There are the Purvarupa mentioned. Samprapti of Kasa, Vada obstruction will be there, which will be Urdha Pravarta, reaches the throat and head. Violent upward movement of the body along with eyes, back, and chest will be happening, which led to the Binna Kamsyopa Adhuni. Coming to the treatment protocol, Ayurvedic line, Vadika Kasa, dry cough, mainly dry cough will be there. Snehavana with Vadara Gradas, Yusha, Mamsarasa can be given. Dhumapana with Vadahara Dravyas can be given. Especially our Acharyas has mentioned that in Vadika type of Kasa, Uttara Bhaktika Snehapana can be given in Vada Pitta Samsarga. Vada Pitta Samsarga, Uttara Bhaktika Snehapana can be given. And Stigdha Virajana in Vada Kapha Samsarga. Vidarya, use of Vidaryadi Kana drugs have been mentioned by our Acharyas. Coming to the Paitika Kasa. Paitika Kasa with Tanu Kapha. Vamana with Gruda and Saindava can be the option. Paitika Kasa with Gana Kapha. Drugs which possess Ruksha and Shida Guna should be opted. Coming to the Kaphaja Kasa. Annavana with Kadu Ruksha Dravya, Yava, Goduma, etc. can be adopted. Vamana can be considered as a treatment option in this Kaphaja Kasa. Drugs which possess Ruksha, Ushna, and Srodana should be selected, especially in case of Kaphaja Kasa. Drugs which possess Ruksha quality, Ushna, and Srodana drugs should be selected. Some of the important drugs which can be given, which can be used in Kaphaja Kasa, if we feel that it is Kaphaja Kasa, symptoms like Kaphaja Kasa Lakshana, Dashamula is an important drug can be Dashamula, boiled water, Pushkaramula. As a single or a combination we can use in this type of condition, especially Tulasi, Pipali, Marija type of drugs can be used. Coming to Shadaja Kasa, Jivaniya treatment I am mentioning, Jivaniya drugs usage is mentioned as mentioned earlier. Amrita Prashakradam, Datriyadi Gradam. In Vada Pragopa, Gradapanam is administered, is mentioned. Is in Pitta Pragopa, small dose Grada can be used. In small dose, Grada can be used. Medicated ghee can be used in small dose. Especially we should consider our acne also in this type of condition. Coming to Shadaja Kasa treatment, some of the medications we can use are Agastya Rasayanam, Kushmanda Rasayanam, Vashishta Rasayanam, etc. Coming to the last type of Kasa, that is Shayaja Kasa. For Shayaja Kasa treatment, as a treatment, Brahmana line of treatment we should follow. Devana Pachana, Mrudu Virejanam line should be followed, and also only Mrudu Virejanam should be given, not very Tishna Virejana drug should not be given in this type of already immunization will be there, so we should take care of that type of patients. And cough with gastric relation. In this type of cough, we have to incorporate Amla Pitta and Kasa Chilsa along, both together. We should try. Drug should be Pitahara in nature. Dibana Pajana drug should be given. Vadan Lomana treatment should be given. Lagu Tiktharasa Rabia should be. Lagu and Tiktharasa Rabia should be used in this. Virejana can be adopted as a treatment option in gastric related cough. Avoidance of the oily, spicy, and acidic food substances should be done. Next one is if cough is with cough if blood is along with the cough, main causes may be bronchitis or pneumonia. So we should take care of the associated diseases. Reason for hemoptysis, but there are so many complicated causes also. We should rule out first what is the cause of hemoptysis. We have to exclude all the possibilities by proper history taking and suitable investigation. Site of origin of the blood should be identified properly. Then we have to treat for the underlying cause. So in this case of hemoptysis with cough, we can, some medicines I have sorted out. Churnas like Lakshadi Churna, Ushyanika Churna can be used in this condition, along with the other medicines. Gridas like Vrushagrida, Shatpalagridam, and in case of emaciation and all Amrutaplasagridam, like we can try. Kashayas like Shadanga Kashayam can be used, but especially in the case of blood with cough, without Shundi, we should use. Also, Vidaryadhigana Kashayam can be tried here. Coming to Aristas, Vasaga Arista. Vasaga is a very good drug for bleeding purposes and all. And coming to Avalehia, Thalisapatradi, Villuadi, Kushmandarasanam. Kushmandarasanam in the yoga, there is indication, especially related this type of blood with. And the tips for having a healthy lungs, we should quit the smoke. As you all know, we should quit smoking. Limited alcohol should be taken. Avoid exposure to pollutants. Minimize the exposure to air pollution. We should treat the infection at correct time. Exercise, healthy weight, protein-rich diet, breathing exercise should be done. And water intake should be correctly maintained. Iron intake should be correctly maintained. And we should limit, the important factor is the patient should limit the sodium intake. And also he should limit the foods which cause increase acidity and all. Okay, thank you all.
Thank you, doctor, for that great presentation. So now this is the time for questions. So you can unmute yourself and you can ask, or else you can type in the chat box. Dr. Smitha is there for answering your questions. So if you have any questions, this is the time to ask. Please, you can ask now, please. Please unmute yourself and you can ask. Okay.
पापा जी को बोल दो चल दिया
Good evening, sir.
Yeah, please.
Yeah, it was a wonderful lecture. Sir, I have few patients. Whenever we advise NASIA, like for example, allergic rhinitis, now the patient's asthmatic attacks are reduced, but allergic rhinitis is often there. But the moment they put any Nasya drop oil into the nostril, the patient there and then starts sneezing continuously more than 15 to 20 times. So the Nasya therapy is never, we can continue in that patient. So what can be the reason of the oil, the moment we put, there are more than 20 sneezes, and what else we can do for that pricking pain, in the throat, and then there is a constant coughing in the night itself, the needle pricking sensation over the pharynx.
Madam, I think the question was clear. Can you please answer?
Yes, yes. What are the medicines you have administered for her, for the patient?
Hello?
What are all medicines you have administered for the patient?
Yeah, for the patient, the one who has this pricking throat pain patient, for that, I had given Lakshmi Vilas, I had given even the Nasya thing. That patient could tolerate. The other patient could not tolerate. And the gargling, that was there. The pricking pain, the patient also had this, this thing, cold problem very often. So I had given Sanshamani Vati also.
Okay.
So all those things are going down, but only pricking pain and continuous irritating throat only in the midnight. That was there.
Okay. Because it may be due to the allergic reactions. It is better to check the IgE and AEC, immunoglobulin E and absolute eosinophil count.
Okay.
If IgE is more, you can use Nirgundi and pepper as a Toya preparation also. It is very good in these conditions. And in the medicines also, you can add Amritarishtam, Vashagadishtam, or if the phlegm is productive, you can give Respicot also.
Okay, there is no phlegm, ma'am. It's only the pricking pain in the night and dry coughing, irritating cough. No productive cough.
Okay, so you can start Agastya Rasayanam in the night, on daily basis.
Okay, and what about the patients who get sneezing the moment we put the oil?
That may be due to sometimes due to the DNS also, deviated nasal septum.
So we should stop.
It is stopped. Instead of that, you can give some nostricap steam inhalation, either with nostricap or turmeric powder.
Okay,
that too, not in the night, during the daytime.
Okay, fine. So we can't try any other oil, Nasya oil or the Ghrutam Nasya.
In this condition, if this there is Amato, in this condition, it will be better to avoid.
Okay, and but Pratimasha Nasya or ghee application?
Better to avoid.
That is also we have to avoid.
Jasnadi Patta on the forehead also can be tried.
Okay, fine.
Jasnadi Churna with water or buttermilk also can be tried.
Okay, fine. Thanks a lot.
Thank you, madam. If you have any other questions, you can ask now.
In the chat box, there are 2-3 questions.
Yes.
Good evening, ma'am.
You better ask your question in the chat box. There's some problem with your mic, that's why. Please.
Hello.
Madam, another question is, generally some patients with repeated history of cold and rhinitis and difficulty in breathing only cold season. Like that it is.
What is the question? I couldn't hear you.
Please tell the nasal or respiratory conditions in which we should not use Nasya.
That I already mentioned, no?
Okay.
Continuous sneezing is there, it is better to avoid the Nasya.
Then what are the main difference between Vatacha, Pittacha, Kaphacha and Kshatracha, Kasa? Main symptoms, cardinal symptoms, that's what they are asking.
In Vadaja Kapha, it is maybe the Vadaja, Pittaja and Kabaja? Kasa, no?
Kasa.
So in Vadaja Kapha, Kasa, it may be the chronic cough is the main. Sometimes with dyspnea also may happen. The breathlessness, while walking difficulty, while little walking itself create lot of breathing trouble. But the intensity may vary. In Pittaja, mostly it's aseptic condition because all are
ഒന്ന് അൺമ്യൂട്ട് ചെയ്യോ? ഞാൻ എല്ലാവരും മ്യൂട്ട് ചെയ്തിട്ടുണ്ട്. ആരോ
ചെയ്തു.
പറഞ്ഞോളൂ.
In Vada condition, in Vadiga Kasa, the most common symptom is the cough itself. It may be mostly it will be dry in nature, and sometimes the headache also may associated with that. Lot of symptoms may appear, but most common symptom is the cough itself in Vada. In Paithika, it may be due to some acid reflux associated with the cough, and some throat irritations may happen. And in the Kabaja, mostly the loss of appetite, all are Amashaya Samudbhavano. So we have to correct the stomach first. Dibana Pajana medicines can be given in this sort of conditions. Especially the Ashtachurna. First, we can try Ashtachurna, Vaishwanara Churna, Hingu Vajadi, or Pipalyasavam, Mustarishtam to saturate the stomach first. After 2-3 days, we can, if the constipation is there, we can do some Mridu Virejana with Avipatti or Kalyana Gula or Eranda. If Kabhanibandhitam is there, it should be eliminated with either with Talisa Patradi, Vyoshadi Vadagam. Then we can start Agastya Rasayanam or some Vyakryadi Kashayam, Elaganadi Kashayam. That medicines can be tried.
How can manage lung cancer?
How can manage?
Lung cancer.
Lung cancer is that depends on the other parameters that histopathology to be understand. In the acute cases, we can try, but in chronic cases, it is better to do the allopathic treatment. The complete details to be available before commenting on this.
Hello, ma'am. In the lung cancer, if the stage is very in the beginning and if the bala is good of the patient, can we do Vamana?
Vamana, I didn't try that.
Okay, thank you, ma'am.
Some Shamana treatment is more effective in this sort of cases.
If the lesion is very minimal in the beginning and if the bala is, the patient is strong. So I just thought to ask this. So can we do Vamana?
That I will answer you later with asking with some other doctors.
Okay, fine, ma'am. Thank you.
Yes, ma'am.
So there is another question. Treatment for lung fibrosis. Can Ayurveda help in rejuvenation of cell? And mostly here in that same message, after use of ghee, symptoms get worse. Please explain in detail how to select ghee and Aushadha Sevana Kala. Like that, a question is there.
In pulmonary fibrosis, no?
Lung fibrosis, exactly. Yes.
That also first, as I mentioned already, this is our Amashaya Samudbhavam. So Ama to be eliminated from the body. For that first stage, we have to choose the medicines Dibana Pajana. Once the Ama Pajana has subsided, once Ama has subsided from the body, we can start Snehapanam. Snehapanam, that is also Mridu Snehapanam. Dadimadi is the best option because it Muda Vada Anulomanam. In the Muda Dadimadi its indication is Muda Vada Anulomanam. You can select Dadimadi in pulmonary fibrosis. And Pathophysiology also a best option because in the indication it is clearly mentioned Hrit Fupfusa. So that Fupfusa is the word only in Pathophysiology. That is also very good option in pulmonary fibrosis. And if in this condition, if the cough is productive, you can choose Respiratory. If it is dry, Vashakot. This is the, but we have to continue the medicines in a long run, because within 1 or 2 months, there will not much change, but some mild changes only. We have to continue the medicines for 6 to 12 months even. Then only it can be manageable. And we can slow down the progression of the disease.
Thank you, ma'am. What can be done for chronic tonsillitis?
Pardon me?
What can be done in chronic tonsillitis?
Chronic tonsillitis. That we can use Hingula Basma capsule along with Indugandham Kashayam. Dashamulam Kashayam also very good in this sort of conditions. Chariya Madhusnehi Rasayanam can be tried. Gargling also a best option with Tribhala.
Next question. In patients those who are having history of asthma, only winter season, it can cope. What should be the line of treatment?
Because all the depends on the symptoms we have to treat in this sort of condition. Sometimes the cough is there, so Dashamula. If sneezing is the symptom, we have to opt Shida Jurari. Or if headache is symptom, either we can choose Patyaksha Datradi or Dhanadanayanadi. According to the symptoms, we have to manage, especially in the seasonal rhinitis.
Then Rasayanam treatment for chronic asthmatics, especially for middle age.
We can go with Agastya Rasayanam or Tippali Rasayanam also we can do, but we have to saturate the stomach first. Because Pippali is little ruksha in nature, so the stomach and the diet also to be taken care while doing the Tippali Rasayana.
Another question, patient with dry cough, especially after having food and palpitations associated with it. What's the line of approach?
That is also again to the stomach, because the digestion, the metabolism to be enhanced. So we can, in that condition, the Amridarishtam plus Pippalyasavam can be tried. And in the Kashayam, the Vyakriyadi Kashayam or Belaji Ragadi. As a Rasayana, Agastya Rasayanam or Shwasaharalekam also can be tried. That is also for a long run.
Then lower respiratory tract infections in pregnancy, how to treat?
Pardon me?
Lower respiratory tract infections in pregnancy.
That also, because Shidajadari, lower respiratory tract. The Shidajadari can be tried. Again, Amridarishtam, Vishwamridam also can be tried in this sort of, in the pregnancy. Mridu Virejanam can be given either with Kalyanugulam or water enema. Because Virejana is more important, Mridu Virejana is more important. And steam inhalation, because we couldn't give that much medicines to for a pregnant lady. So nostril cap inhalation, Rasnadi Patte or Kachuradi, according to the dosha, we can choose.
Thank you, ma'am. At which stage Gridha is used in the TB patient?
That also, once the Bella has to be retained, the fever, all the chronic symptoms to be reduced, then only we can use the Gridha. Amrita Prashagridam also can be tried, but not in the first 2 stages, on the last months during the treatment, after the ATT.
What is the role of Ayurveda in ILD?
ILD, as you know, it is a progressive scarring of lung tissue. That also leads to pulmonary fibrosis. In the ILD, Belajiragadi Kashayam is the one which we get good result. And Vidaryadi Gridam also in the night. These 2 medicines will help in this condition. Shwasanandam also may be added as a along with the Kashaya. And one difficult procedure for the ILD is our Dr. P.K. Warrior sir always use this method, that is mustard, mustard grinded and pasted in a cloth. That cloth to be tied over the chest. The cloth should be in touch with the body outside the mustard paste. That we can keep it for 10-20 minutes because it creates a lot of burning sensation. So once the burning sensation starts, we have to remove it. This method is very good for the ILD.
Thank you, ma'am. Is this a question that please give treatment for a eustachian tube blockage for a child of 14 years of age? Symptoms of less hearing from one side. Eustachian tube blockage.
Less hearing from the
one side. One side, exactly.
Since
14 years.
it is there? Since birth or?
They have not written like that. They have just written 14 years. Symptoms are there, but from when they have written, madam?
For three years.
For 3 years. Personal consultation is it will be better. Sometimes Shirogasti may help and Karnapuranam also may help, but we have to see the patient.
Ma'am, another question, can we use Dushi Vishari Gulika for AMA in this type of lung conditions?
Yeah, Dushi Vishari and Villodi Gulika also can be tried, especially in the elevated IgE levels. Both are good.
Internal medicines for bronchiectasis with persistent cough and dyspnea.
Bronchiectasis, it is a permanent damage, no? So it should be classified into two, actually the medical management and surgical management. So that first we have to understand the condition of the patient. If it is medically management, first we have to drain the postural drainage is the first thing we have to do, because the mucus and sometimes the blood also collect in the alveoli. So the postural drainage, that means the patient has to lie on abdomen and we have to tap on the back. Am I audible?
Yeah.
You're audible. Yes, you're audible.
And Tikta Rasa Pradhana condition, Tikta Rasa Pradhana medicines to be included, especially the Mahatiktam, Nimbamradadi Panchatiktam. And in the Pushmanda Rasayanam also a good option. If it is symptomatic, Chavanaprashan can be tried.
Then line of treatment for OSA.
Sleep apnea, obstructive sleep apnea.
Yes.
So the sleep apnea, first we have to do some the exercises for the abdomen actually, because that portion diaphragm blocks the airways. That is one of the reason. And one good result we found it is Nimbamradadi Airandadailam plus Kachuradi Churnam for the thala, for to be applied on the vertex at bedtime. That is the one good result we found.
Madam, chronic asthma dependent on steroid nebulization of Eucoped every day since 7 years and history of angioplasty. Male, aged 80 years. Treatment plan, please.
That personal consultation is required because the steroid we couldn't taper it. Along with the allopathy, the steroids, we have to introduce the Ayurvedic medicines according to the condition of the bella of the patient.
Sinusitis patient with respiratory distress but Pitta Prakriti, where all Ushna Tikshna are causing side effects like boils, Udarashula, etc.
So Thalisapatradi can be tried, no?
Supportive medicines for patient on ATT, antitubercular.
In ATT, the Indugandham is the best option. Ashwagandha also can be added along with that.
Complaint of dry cough since 1 month with history of pulmonary TB with pleural thickening from last year.
Anyway, ATT has started. They already started, no? So in the Vyakradi Kashayam or Nayobayam Kashayam can be started now itself if the bella is, if no amatam is there.
allergic rhinitis and DNS, what would be ideal internal treatment in the form of tablet as the patient's occupation is driver?
That Shidajurari plus Hingulam. And if the DNS is there, in the first question, it was Nasyam, no? Nasyam, we can, Pradimarsha Nasyam can be tried with Anudailam. But if sometimes, if with the Nasyam, it will increase. So stop it and do the steam inhalation. The Shidajurari and Hingulam and Chavanaprasham also can be make use of.
Is there any treatment for snoring as such?
Snoring the same pace, no, the Nimbamridadi, Erandadailam plus Rasnadi can make use of for the vertex, the paste application of the vertex and the postural change.
So the questions that has been put in the chat box has been answered. So if we have any more questions, we can ask right now, or else we can end the session. If you have anything else to ask, you can ask now, or else we will end the session. There is a question here. What madam told to be taken with the Nirgundi in increased IgE?
Nirgundi plus pepper.
Nirgundi plus
in toya preparation, boiled in water and drink that water.
Then another question is persistent cough and cold in children, line of approach.
That also Vashaga Derishtam or Vashakot syrup that plus Pushmanda Rasayanam can be given in long run.
Okay. Painful maxillary sinuses.
If that Pradimarsha Nasyam can be tried. And Pradimarsha Nasyam can be tried.
Okay.
But in all these conditions, head oil can be avoided because in Shasakasa, if the sometimes it may cause lot of allergic reactions. So while giving the medicines, normally we are advising the patient not to apply oil on head till the symptoms subsided.
Another question is, can Ayurveda only, by giving Ayurveda only, can we cure TB or not?
We didn't try because the TB is a notifiable disease. So we have to intimate the health department. So we didn't try that.
Jirna Vatacha Pradishyaya.
Treatment for?
Jirna Vatacha Pradishyaya, madam.
Okay, that also that Jirna condition to be eliminated first. So Dibana Pajana Aushadas can be given. Then the treatment for the rhinitis. That Shidajurari, Hingulam or Rasasindura.
Due to vocal cord injury during surgery, now dry cough with throat irritation. Is there any treatment?
So what sort of injury was that? Is it due to the paralysis or?
Dr. Leena, can you clarify that? What kind of injury was that?
It is due to surgery, during surgery. Okay, okay.
Okay, okay.
That also in this condition we can try some medicines with muhu infrequent taking. Haridra Marijadi Lekhyam can be tried in 1/4 teaspoon every 3-4 hours. Can be tried.
Again, another question is what kind of treatment can be given for TB if patient is not able to take ATT?
Indugandham can be tried. Indugandham kashayam or tablet form.
Okay.
Brihachagaladi Grudam also can use makes it tough.
Then recurrent throat infection, like for dust, raw onion, he is getting throat infection, it seems.
That in that condition, gargling is more important. And in the medicines also, some rasaushadis like hingulam or rasasinduram, rajadabasmam also can be tried in if the cough is there. And Charya Madhusnihi Rasayanam or Pushpanda Rasayanam can be tried.
Frequent postnasal secretion and sometimes vomiting of kapha. They have put a question mark. I think they need treatment for that. Postnasal secretion and sometimes vomiting.
Postnasal secretion, we can use the Shidajorari type of medicines. External application also find very good result in this for the postnasal secretion, the Rasnadi Patte on the forehead. And don't use any oil on the head before bath or after bath. And vomiting of kaba, sometimes vomiting of kaba, that also can be treated with Amapajana Dravyas. Vilyadi or Mahavilyadi Leham can be used.
So I think we can wind up the session, I suppose. Most of the questions has been answered. Before winding up, this session is being, live streamed through YouTube. So if you want to see the video of it again, I will just copy and paste the YouTube link in the chat box right now. Please copy it right now there in the chat box. So you can use this link to watch this video whenever you want. And if you have any more questions, you can put your questions at marketing@ayurvedishala.com, our mail ID, which is being sent to the chat box again. If you look at the chat box, you will find it. Marketing@ayurvedishala.com, and the our link is also there. You can find it. So just copy the link. Madam, if you have any closing remarks to say, you can say that. Anything to add, or else we can. That's it.
I answered the questions. If there is any doubt, we can clarify later also.
Sure. Dr. Sreejith, are you there? Hello. So it was a wonderful session. Both Dr. Sreejith has properly explained, and Smitha madam has given wonderful answers. Hope it was helpful to you. So we will be coming with more such sessions. Thank you for your time. Thank you for your time, madam. It was wonderful meeting you again after a long time. Thank you. So I am closing the session right here. Please, you can log off, madam. I will close it from here. Thank you, madam. Thank you.
Thank you.